guys. Good morning, good afternoon, good evening, good day. Hello, wherever you are. My name is Life Matters, and my name is Anita. Today, I'm going to start my new series called The Road to Recovery. The Road to Recovery. So, the road to recovery is not an easy road. There are a lot of people involved on this journey. So, on the journey to recovery, there are a lot of people involved. I had my friends, I had my family, I have my doctors, I had the nurses, I had my husband, I had my son. So, all these people, I had the NHS in a whole. So, all these people are in the story of the road to recovery. All these people are parts of the story of the road to recovery. So, like I said the other time, I was in ICU. I don't know much about what happened in ICU. I will let you know. Any information that I get, I will bring it to you. But yes, I was in ICU and I was transferred to HDU. So I will start from HDU since I know what happened in HDU. So in HDU, like I said, is the high dependency unit. HDU is the high dependency unit. So I was in HDU, and in HDU, you are in a room on your own. There is a big glass window, a massive glass window. So the doctors and the nurses are sitting outside and they are monitoring your condition. So they are monitoring everything. They are monitoring your heart, your medications, how you are doing, how you are feeling, your temperature, how you are responding to treatment. They are monitoring all of it. Now, somebody asked me that how long does it take you to recover after a liver transplant? How long does it take you to recover after a liver transplant? I have said that it always depends on how sick you were before transplant. How sick you were before transplant. Some people get to work and some people get up, few months after transplant. It all depends on you. We all respond to treatment very, very differently. We all respond to treatment very, very differently. So it all depends on how sick you were or how ill you were before the transplant. So I'll continue by saying that getting well depends on you. Some depends on how you respond to the treatment, but most of it also depends on you. Even though the doctors are trying their best to get you better, you also have to try your best to lift yourself up, to try to do, little things for you to get better. So yes, I was in the high dependency unit. The doctors are outside monitoring my condition, monitoring how well I am responding to treatment. If they have to give me blood transfusion, is that they have to give me some food. If they have to be, everything was passed through tubes because I wasn't eating or even talking. And somebody also asked me, how big is the cut? Well, the cut for liver transplant, my cut started just from under my breast. It comes straight to where, just close, very close to your belly button. So very close to your belly button. It doesn't get to your belly button. Then it is cut to the right side of the stomach, of the belly. So it is cut through the right side. So it starts from just under your breast. Just as it gets to the belly button, it curves to go at the right side of your belly. So that is how the cut is. It is one of the biggest cuts in surgeries in hospital. It's one of the biggest in hospital. After that, when they close the saw, what happens is when they close the saw, with me, they stapled it to close it well. So I had staples. You know what staples are? So I have staples. So they stapled all of it, all the line, all the cuts to close it well, to close it well. And I had my dressing on it. So I was lying in the high dependency unit, and the doctors were monitoring me. I was being fed through a tube. I had a catheter. I wasn't getting up at all. I wasn't talking. I had a tube. I had a tube inserted through me. So a tube was passed down my mouth. A tube was passed down my mouth into my windpipe, and it was attached to a ventilator to help me to breathe. A tube was passed through my mouth into my windpipe and attached to a ventilator to help me to be able to breathe well. So all these tubes, they were monitoring it. All these tubes, they were monitoring it. Another tube was passed through my nose into my stomach to prevent my stomach getting bloated. So the tube was passed through my nose into my stomach to prevent my stomach getting bloated. So this tube was given to me during transplant and after transplant. The tube is not taken out till I am ready to eat and drink. The tube is not taken out till I am ready to eat and drink. And small tubes, very small tubes, were also inserted in my arms. So small tubes were inserted in my arms to help them give me my fluids and my medications. Tubes were inserted through my hands to be able for them to be able to give me my fluids and my medications. So that is how everything was. I was also given a catheter. So the doctors were there, the nurses were there, they were all monitoring me and seeing how well or how good I am responding to treatment. How good and how well I am responding to treatment. My sore was at least dressed every 2 days or every 3 days. So every 2 or 3 days, I get a new dressing on my sore. Every 2 or 3 days, they come to dress my wound for me. The doctors are so good. I had doctors with me 24/7. They were monitoring me. I had my nurses there 24/7. They were monitoring me as well. I was getting better. I was responding very well to treatment. I was in a lot of pain. I also had tubes at my side. I had two tubes at my side. One was getting rid of the excess fluid in my stomach. So I had a tube at my side, at the side of my stomach, um, getting rid of the excess fluid in my stomach. So that is how everything was going. It was painful, but like I said, I had my painkiller button with me that I was pressing every few minutes. I had my painkiller button with me that I was pressing every few minutes. I remember that after about 2 days, the doctors came to me to tell me that I am responding very well to treatment. I was responding very well to treatment. It was a very happy day for me that I was responding well to treatment. I hadn't started eating, so I wasn't eating. How everything was given to me through the drip. So, like I said, on the road to recovery, there were so many people involved on this road. I had the doctors, I had my nurses, I had the domestic workers in the hospital, I had the NHS in the whole, I had the surgeons, I had my husband, who was, he was of great help. So I had my husband, I had my wonderful son, I had my brothers and sisters, I had my family, my mom and my dad, and I had my in-laws, and I had my lovely friends with me. So I was doing very well. I wasn't remembering a lot of things. I remember that every now and then the doctors will come and ask me, they'll give me something like a pencil Then because I'm not talking, so they'll give me something like a person, then I will try to write my date of birth. I will try to write my date of birth because they saw they see this they were saying that with the way I was very, very ill, with the way I was very, very sick before transplant, I could have, it is possible that I could have gotten a brain damage as well. So even though they were looking after me, they were testing my brain as well. So every now and then they'll ask me, what's your son's name? What's your husband's name? What's your date of birth? And then I'll be writing it for them in bed. So that is how everything started. I was responding so well to treatment the very, very first few days that I was in HDU. HDU is where I started getting better. They were also looking after the new liver so that the body doesn't reject it. Everything was going so well. I will end here. I will come your way again. I'm trying to make some